care for our veterans has been a hot topic ever since the massive troubles at VA hospitals were uncovered. And now one of our local health leaders has been selected by the president to help improve care for those who served our country.
Henry Ford Health System CEO Nancy Schlichting will be appointed to serve as the chairperson of the Commission on Care, created by Congress to figure out the best ways to deliver health care to veterans. She's been CEO of Henry Ford since 2003 and has received several accolades for her work with the health system there, including being named one of the top 25 women in healthcare 4 times by Modern Healthcare magazine.
And she joins us now live. Nancy, thank you so much for joining us. Nice to see you. Tell us about this commission. What will you be doing with this commission?
Well, it's a tremendous honor and a tremendous responsibility, but I will be serving as chairperson of a 15-member commission that is commissioned by members of Congress as well as the President to really evaluate and provide recommendations on ways to improve veterans' health care.
Now, if I remember correctly in some of our interviews on health care, you've not always seen eye to eye with President Obama on the health care plans, but the President basically gives you a call and says, I need you to do this. What's going through your mind?
Well, he didn't call me personally, but I got a call from the Deputy Secretary of Veterans Affairs, Sloan Gibson, and frankly, I was just so amazed and honored by the opportunity to serve in this way. So I certainly support President Obama on providing health care access across our country, trying to improve the quality of care, and when it comes to our veterans, there's nothing we all wouldn't do to make sure that they get the care they deserve.
Yeah, it was so embarrassing to see so many national stories on how veterans have been treated really across the country and their delayed care. So what specifically will you be doing with this commission to help our veterans? Because so many families are watching and they want better health care for their loved ones.
Well, one of the things the commission will do is take a lot of information in. There's been an evaluation going on now for several months with outside consultants to really evaluate and provide input to the commission on everything that's going on in terms of VA health. So we will be taking that information and working for about a 6-month period of time to really assimilate and come up with recommendations moving forward. It's a very diverse group. It includes half of the members will be veterans, and people with specific expertise in healthcare are being engaged as part of this process. So I think it's really going to be an effective way to advance, I think, what we all want, which is an effective system of care, making sure that we're paying a lot of attention to the immediate needs of our veterans.
What kind of timetable are we looking at here for getting started on this?
It is, we expect to have it start in August, and it is about a 6-month period of time. At this point, it may take a little longer, we don't know, but we're targeting a 6-month period.
Well, we certainly wish you a lot of luck, because I know our veterans need a lot of help, and we're glad that you're going to be at the helm, because I've seen your work here in Michigan, and I know you're going to do wonderful things.
Thank you so much. I really appreciate the support.
All right, thank you. All right, still